universal access has to be considered exactly as such, universal access. And human rights has to be brought back in the heart of the response to HIV. Accessing services is a right, and that right is inherent. So any barriers to accessing services is a human rights violation, be it a law that prevents anyone from accessing services on the basis of their sexual orientation or practices, or practices that prevent the availability of services to a certain category of people, or information that, or the lack thereof, on same-sex activity to same-sex practicing people, are all examples of human rights violations. They are all examples of the way in which the inherent right to access services is being violated. And the second aspect is that state responsibility or state duty to secure and protect the inherent right to access services has to be brought back in the agenda, and it has to be monitored. State have to be accountable to the way in which they ensure that services are available and accessible for everyone. And I'm one of the people who believe that this state's commitment to the fight against HIV should be measured by the way in which they address or respond to the epidemic in their most at-risk populations. That is how you understand how committed a government is to the issue. Because if you want to address the epidemic and do not address the epidemic in its pockets, then you are not committed to effectively address respond to the epidemic.
The steps that should be taken. I don't think that there is any way which is the perfect way. I think it might be different in different situations. Very good examples are Uganda and Kenya. Kenya has a vibrant MSM program, HIV programming, and it started as a public health program. Then it has morphed into rights for the MSM, for the LGBTI community. And at the same time, it was around that time that they also had the new constitution, which was a very good boon, because they literally were able to affirm the right of homosexuals and heterosexual Kenyans to certain basic rights. Now, that has worked for them. In Uganda, it's a bit different.
Having to discuss same-sex practices is also a very big challenge, and I think we need to start having that conversation at a community level, but with identifying leaders that are already in positions of influence that we can target. And I think that there is so much room for us to have these discussions. And I don't think that it is an impossible situation. There are possibilities. If we have started talking about universal access in HIV, we are talking about zero new infections. We are talking about everyone having equality to services. Even issues of public health are being brought up to make sure that everyone has access to that. And when we talk about that, we are not being selective. We are talking about anyone and everyone within that particular community. And if we start including even sexual minorities at that level, I think we'll be able to make a difference in the next coming years.